Okay, the following presentation, Dentistry for Thinking Riders, is presented and narrated by Dr. Shannon Lee. Information on Shannon can be found by visiting the web address or Facebook site listed at the bottom of this slide. Okay, I want you to have a look at this slide and have a think about whether you own one of these. Now, I'm not specifically talking about this style of bit, just simply whether you own a bit and bridle. And for those of you cleverly, smugly sitting on your hands thinking, well, I don't own one of these, I use a bitless alternative, such as a hackamore, or a Bosel, or a halter, that's no problem, but most of what's in this presentation will still apply, so please have a look and see what you think. Thank you. Okay, here we see probably two of the most common types of bit found here in Australia, broadly speaking. So on the left we've got a couple of types of simple snaffle, and on the right we've got a double jointed snaffle or French snaffle. I want you now just to imagine a scenario for me. So if we think about a young thoroughbred racehorse in work, and we think about that horse in work at the track, at the gallop, so if we have a snaffle bit in this horse's mouth, just think about the horse's head position, so the neck's extended, the nostrils are raised, travelling at speed, large volumes of air, and so the horse's head position, the position of the bit, the position of the reins, the position of the rider's hands will be completely different, even if we have the exact same bit and bridle. If we now take the same horse in the same tack and ask the same horse to start doing perhaps dressage, so now we've got a collected frame, vertical head carriage, different pace, different position of the rider's hands, and so the same bit and the same bridle in the same horse will be acting in that mouth in a different way. Okay, so here we see that young chestnut thoroughbred horse recently making the transition from being a racehorse to going into being a pleasure horse or performance mount, in this case doing some elementary dressage. The problem here is actually visible in the photograph, so I'll give you a second to have a quick look. If you've picked it, fantastic. If you're still struggling, don't worry, we're going to show you a very short video which hopefully will explain the issue here.
Started.
Okay, so the problem here is that the bit's making contact with his upper canine tooth. His upper canine tooth's not through the gum. It's getting a bit agitated, but if I take that canine, take that bit, touch it on the canine, we get an instant reaction from the horse. If I let that go, the horse pretty much relaxes again within reason.
Okay, so here we're looking at the corner of the lip, or because we're now talking about dressage, we're going to use fancy European terms like commissure. So this is the lip, or the corner of the lip, or the commissure. And what are we seeing here? Well, obviously we're seeing an area of trauma or ulceration to the corner of the lip. This can occur for a number of reasons. Horses, just like people, can have sensitive skin. There'll be many of the people watching this presentation who perhaps use lip balm or chapstick because they have dry lips that crack. But another one of the ways that this can occur in horses is that this is the region where the cannon or shaft of the bit is going to make contact, and so in a number of different ways the cannon of the bit can cause this injury. It can occur if the bit's dirty, so it's got food material, etc. on it. It can occur if the bit's rusty, or if the bit's abrasive in any way. It can also occur if too much pressure is applied to this area, and it can also occur if you have a loose ring bit, like we saw in some of the earlier slides. There's nothing inherently wrong with the loose bit design, but just so you can appreciate it, if you think about the ring has to slide through the area where it adjoins to the cannon, so the shaft of the bit, and it is possible for that skin, this skin here, to be pinched by that ring, and these are the types of injuries you're going to see. So as thinking riders, one of the simple things that you can do is to simply check this area before and after each ride, and this could be a one-off injury, but by just identifying that there is a problem, it may alter the way that you manage that horse in future, or simply for the next few days while the injury heals. So here we're looking at another slide, and again you can all identify the problem because we've just been through it in the previous slide and the previous video. So of course there's bit contact with the upper canine in this pony. However, if you look at the photograph, you'll notice there are at least two other problems in this photo. So I'll give you a second to have a quick look, see if you can identify them. So if you were able to spot them, fantastic. If not, we'll just talk you through it. So the first thing is, you'll notice this is a relatively young pony, relatively short crowns. That's the part of the incisors, the front teeth that are in the mouth. And if you look carefully, you'll notice his mouth is actually open. So if his mouth was closed, as it ideally should be, there would be even less room between that very thick tongue and the roof of the mouth, or the palate. So the second thing you'll notice is there's food material on this bit. This bit's not clean. So we've got three problems in this photograph. We've got bit contact with the upper canine tooth, which is going to stimulate the nerve in that tooth. We've got a bit that's too thick for this particular pony at this particular age in this particular application, and we've got a bit or tack that's not clean. Okay, so here's another bit you may be familiar with. It's a solid mouthpiece. It's made of plastic or rubber. There's nothing inherently wrong with the design. It's a loose ring design, and the thought here is that it's going to be a kind bit to use in certain applications. Okay, so here's the same bit in the horse, and if we look at the photo, we can see the problem, can't we? Okay, again, if you've identified it, fantastic. But if you haven't, if we look closely, you'll notice what about this horse's mouth? Yep, it's open. So this is an older horse, but again, it's reached a point in its life where we've got short crowns, so that's the length of the tooth in the mouth. So here we're talking about the front teeth, the incisors. So in this horse physically can't close its mouth with this particular bit. So for this particular horse at this particular age, this particular choice of bit is not appropriate. And it's as simple as just checking the tack on the horse and identifying this problem, which is visible to anyone who takes the time to look. Okay, so now we're stepping into my office. This is what I see every day. So just to orientate you, looking directly into the mouth of a horse, on your left you're going to see the upper cheek teeth, and you'll see that they have been floated. In other words, the sharp enamel points have been removed. And if you look to your right, you'll see the sharp enamel points, these projections coming out off the side of the teeth. Now, if we think about it, if we're riding this horse, we've got a bit in its mouth. If we're using a halter or a hackamore or a bosal, any of these things are going to have nose bands, cheek straps, that type of thing. And so when we ask the horse to give and to flex and to turn, it's going to put pressure on those cheeks, forcing that very delicate soft tissue against these sharp enamel points, enamel being the hardest substance in the body. If that continues to occur, we're going to get abrasion of the cheeks, we're going to get ulcers. Okay, so here we're seeing a horse's mouth that's got ulceration because of sharp points. You'll notice we've got a sedated horse, a clean mouth, a bright light source, and a mirror, and it takes all of these sometimes to see some of these issues, even these obvious ones. That mirror is not a magnifying mirror, okay, so this is a very large ulcer, and I think the key points to take away from this are, one, if you've ever had an ulcer yourself, you'll know that it was painful, so this is a welfare issue. Two, it was irritating and that your tongue consistently went back to it, so it's something that's going to be of low grade but constant irritation. And three, that it's going to be a potential performance issue. The other point that I think it's important to be aware of is this is completely preventable in our horses. Okay, so here we are working in the field. This is how I operate. I've got a horse here, you can see, so he's in the crush, he's sedated, he's prepared for an examination. Just a bit of background history on this horse. He's 12 years old, he's just been purchased. He's a nice horse, well put together, got a good background. However, the new owner, experienced rider, is having trouble getting him to track in a straight line and to take the contact. And so we're going to look at a couple of things. I think it's important to be aware that this horse has not had a dental exam prior to purchase, and I think that's something that all horse owners should think hard about, because prior to purchasing the horse, you've still got time for negotiation, you've got time to think about it. However, if you wait until you purchase the horse before you have an oral exam done, obviously the horse is then your problem. Here we're looking inside the mouth of the horse in the previous slide, and as I said, 12 years old, and we notice that he still has these large wolf teeth present, the two teeth that you see in front of the first upper cheek teeth. Wolf teeth, like all horses' teeth, have nerves in them, and the bulk of this horse's problem with taking contact and tracking in a straight line appears to be that when the bit enters the horse's mouth and that metal contacts the tooth, it stimulates the nerve, causing him pain. Here we're seeing the two wolf teeth having been removed from the horse's mouth. For those of you watching this presentation who are familiar with Australian currency, you'll realise how large that coin is. For those from other countries, unfortunately, I apologise, you'll just have to work it out for yourselves. The piece at the bottom of the slide, the coloured piece, that's the crown. So that's the part of the tooth that we could see in the previous slide in the mouth. All of the rest of that is what we call reserved crown and root, so it's the area under the gum. Does anybody know what the red material is attached to the tooth? Okay, so if you worked it out, wonderful. If you're not sure, let's talk you through it. So, when we've got a tooth in the mouth, we've got the tooth, and then around it we've got the bone of the jaw, or the alveolar bone. Now, there is a material that keeps one of those tissues, the tooth, attached to the other of the bone, and that tissue is called the periodontal ligament. Perio meaning around, and dontal meaning tooth. So when we want to remove a tooth, we can't pull a tooth, but we must actually extract it. The reason we make that point is because in order to remove the tooth properly, it's just like when you were a little child and you wanted the money from the tooth fairy. What did you do all night to get that tooth out? Yeah, you wiggled it, didn't you? So in this case, what we need to do is we need to break down the healthy periodontal ligament, and that's the red material you see attached to the tooth. That's how we make sure we get the whole tooth, we don't fracture it, leaving behind any nerve tissue. Here we're looking at a young horse, and I think looking at him you can say that his demeanour is not great, he's not very happy. There are lots of causes of this, but I think it's reasonable to say that if you've got a young horse and he's consistently not happy, it's going to be difficult to get him to focus on his work and to continue consistently with his education. So now we're looking in the mouth of this same young horse. Just to orientate you, that's the palate through the middle of the upper part of the photograph, and to the left and right you've got your upper cheek teeth. For those of you who see the problem, fantastic. For anyone who needs a little help, if you notice there's a line running from the front to the back of the mouth, roughly halfway down the tooth, the first cheek teeth. So what we're looking at there is actually two sets of teeth. Lower down towards the tongue, those are the deciduous or baby teeth, and then upper closer to the gum, those are the erupting adult teeth. So he's at an age where he's teething, he's shedding teeth, he's erupting teeth, and if they shed normally, fine. If they don't, we're going to start to get food trapping around those teeth, which is, of course, yes, periodontal disease. So remember, perio around, dontal meaning tooth. So here we're looking in the mouth again of the same horse. We're looking this time at his lower jaw, and again, you notice that when we look in the mirror, so again, sedated horse, head support, crush, light source, clean mouth, mirror. And when we look closely, if you look along between the teeth and the tongue, you'll see food material sticking out. If you look into the mirror, you see more food material as well as this ulcerated gum. So what we're seeing here is an impacted deciduous tooth, or a retained deciduous tooth, or a retained cap. So this is painful for the horse. We've got a periodontal problem occurring, and in this particular horse we removed the tooth, and immediately we saw we saw an improvement in the clinical signs, the behaviour of the horse. I put this slide in just to show you that horses are inquisitive by nature and they use their mouths to explore. So they're going to put things in there that they shouldn't. This is a problem that I see quite commonly, and I think you can all see the problem. Some of you may not be aware of specifically what you're looking at, but this is a piece of wood. Okay, this is a tree branch wedged firmly across the horse's mouth, and the question I would ask you is, would you know if your horse had this problem? And what I would tell you clinically from my experience is that all of the horses I've seen with this problem, I was not called because the owners thought there was a particular problem with their horse. These were just horses booked in for routine dental examinations, and then when we opened the mouth, this is what we found. So here's that piece of wood after removal. Again, this is a piece of gum branch, which is a tree that grows here in Australia. You can see if you look at it, the size of it. Okay, here we see a horse, and regardless of your personal preferences, you'll see that he's wearing both a halter and a bit and bridle, and again, all things considered from the outside, I think it looks pretty normal. Here we see the same horse. This time we've pulled the lips down and we're looking inside his mouth, and this is something I suggest you do before and after each ride. For those of you who can see the problem, fantastic. If you're having a little trouble, what's this little area of redness directly above the bit? So if you look carefully, you'll see the outline of a tooth there. We've got an impacted upper canine tooth, and when this horse is ridden, that bit comes up at the transition, at the trot particularly, and presses against that gum, and you can see it's bleeding. So this is painful for the horse, and it's as simple as identifying the problem and then adjusting the bit and bridle accordingly.